We mentioned twice already PrEP. So PrEP is a pre-exposure prophylaxis, basically a preventative approach for HIV. It's a daily pill that can reduce your chance of getting HIV from sex or injection drug use. And when taken as prescribed, PrEP is actually very highly, we're talking about more than 90% effective for preventing HIV. The first PrEP was approved by the FDA 10 years ago in 2012. And I really wonder, how do you observe as Ash Wellness and as someone who's in the space, how do you observe the advancements that have happened in the last 10 years in terms of prevention and attitude towards these kinds of approaches?
There has been some stigma reduction, but in general, it's still a very prevalent issue today. It's something that we often speak about as a team and also with our partners in the public health sector, is that the CDC's 2020 HIV surveillance shows that HIV diagnosis actually dropped 17% between 2019 and 2020. However, the problem is that this drop is due to the decrease in testing. As according to another report from the CDC, the number of HIV tests funded by the CDC and sort of administered by these healthcare settings dropped by 43% over that same time period between 2019 and 2020. The pandemic, though, has sped up the adoption of self-collection testing and testing at scale.
I was doing some research and I was looking at the availability of testing, just general search, Europe, UK, US, and especially in the US, there really is a large number of kits that you can either buy in the pharmacy or order over mail. It's worth emphasizing here that when we are talking about at-home diagnostics in this case, it's not about rapid testing as we use for COVID detection. It's actually just about the sample collection that's then processed in a lab and you get results after a few days. So I guess the reliability is different than you would have with point of care tests. And testing is really important when it comes to STIs because we mentioned PrEP, which is preventing HIV, but it doesn't really impact other diseases. So some STIs such as hepatitis B or genital warts can be prevented with vaccines, but most other types of STIs are basically not preventable. So you would need to get tested and the partner would need to get tested to be sure that both don't have anything before you interact. So how would you say that home testing is addressing the challenges of transmissions and just decreasing the number of infections with sexually transmitted diseases?
Yeah, making at-home testing, a thing of that's extremely common is making it accessible, which means that more people can get tested and more people can know their status, and also it decreases the stigma around it. Because if you're ordering a test kit to be delivered to your house, you don't have to go in and speak to someone and disclose your sexual history. So there's sort of that barrier to care is being taken away. The test kit can be delivered to your house the very next day. You can self-collect in the privacy of your at-home and get your results within 3 to 5 days, and then deal with any sort of care or post-care like treatment. I think that at-home testing, as it becomes more widely adopted, will definitely decrease the rate of STIs by helping people just have that additional access to care and decreasing the stigma around testing.
Can you explain a little bit further what is the accessibility like in the US? Because even though these tests are relatively easily available, they do at the moment cost between $150 to $300 US. So how much of that is covered by the individual and how much by the insurance? Let's start there.
In terms of accessibility, affordability is really high up there. And ASH is actually exclusively a B2B company, which means that we support existing healthcare systems instead of retailing directly to patients. In doing so, the majority of our services are actually covered by insurance or public health funding. From a policy standpoint, California passed the SB 306 bill that requires insurance companies to cover at-home testing for STIs, which is a huge, win. That SB 306 bill ensures a pathway to STI services for low-income and uninsured LGBTQ plus patients. and it's going to expand access of to STI testing and treatment in the home and amongst that community. And lastly, to add there, under the Affordable Care Act, PrEP, and the testing and care associated with it, prescription, is required to be covered nationally by health insurers. So how we sort of work is we're not retailing to the general public. We're working with healthcare systems, whether they be private or public, and it is covered by public funding or insurance.
If I understood correctly, ASH is basically providing the infrastructure for the providers of, let's say, telemedicine or just labs that are offering the analysis of these samples. So I'm wondering, what are the demographics of people that actually take these tests? Because I think like 50% of all STIs are prevalent in the population between 18 to 24. There is a younger population, maybe less aware of testing, even if there's out-of-pocket costs related to that. That might be the population that has a harder access to that.
Yeah, I mean, I lead strategic partnerships at ASH, so I deal with different verticals that we sort of sell into or partner with. And those different verticals are university healthcare, private healthcare systems, public healthcare entities, and then the sort of digital health wellness brands of the world. And I think you hit the nail on the head with regards to the growing STI rates amongst, people aged 18 to 24. And that's why universities are a huge place to consider and to enable at-home testing at. And it makes a lot of sense for us to partner with university healthcare systems to ensure that students or college-aged people have access to at-home testing and are able to easily screen themselves for STIs. Other than that, the demographics obviously include public health settings, so the people who are within those populations having access to at-home testing, whether it be a test kit being delivered to where they reside or having test kits available at events for them to easily access, pick up, self-collect. We have situations with public health partnerships where they'll throw an event, they'll go to a concert in a community, music concert, a festival, and people will be able to pick up those at-home test kits. They'll take them to a bathroom nearby, they'll self-collect and drop them back off with whoever distributed that test kit, and it just helps it helps bring people into care, basically. So we're trying to meet all the different populations where they're at through partnering with relevant verticals within the healthcare sort of spectrum.
Can you explain a little bit further where ASH Wellness fits into this whole picture? So we mentioned that you're not a telemedicine provider, you're not a B2C provider, so you don't directly interact with patients, you're basically an intermediary. So what is the relationship between you, doctors that offer telemedicine, let's say, the labs and insurance companies, for example?
So ASH Wellness is basically the tech behind at-home diagnostics. We have an API-first tech platform that acts as a middle orchestration layer for self-collection testing, which means that we offer this end-to-end solution. So we pick, pack, and ship white label test kits for our partners' patients. So, a doctor at a healthcare system would be able to order a test kit and send it out to their patient, and it would look and feel as if it's coming from that healthcare system. So we do the fulfillment, pick, pack, and shipping of white label test kits. We have a compliance management team, so a network of providers across all 50 states who are able to review and approve the test kit orders based on the state in which the patient is ordering a test kit from. We then work with all the leading labs that are based in class for at-home collection or self-collection testing, which means that they basically integrate with our platform. So our clients' patients have access to every single diagnostic that those labs have validated for. So not only STI testing, we actually offer over 150 different diagnostics, ranging from STIs to hormones to gender wellness to heart health, fertility, etc. So it means that our clients in public health or our clients in private healthcare systems have one point in access to access all these different diagnostics.